Overview of thyroid gland. The thyroid gland is essential to the endocrine system. It is a lobular endocrine gland, typically with two lobes, butterfly-shaped, which located at the neck below the larynx and is responsible for the production of thyroid hormones, thyroxine, T4, and triiodothyronine, T3, which are primarily responsible for regulation of metabolism. Both hormones bind to a protein known as thyroglobulin. How is thyroid gland work? Production and secretion of thyroid hormones, T3 and T4 into the blood circulation are regulated by a negative feedback mechanism, which involves the hypothalamus, the anterior pituitary gland and the thyroid gland. When the circulating levels of thyroid hormone, T3 and T4, is low, it triggers the hypothalamus to secrete thyrotropin-releasing hormone, TRH. The TRH stimulates the anterior pituitary to produce thyroid-stimulating hormone, TSH. The TSH, in turn, stimulates the thyroid to produce thyroid hormone until levels in the blood return to normal. Elevated level of T3 and T4 in the blood circulation will inhibit TSH and TRH activity. Functions of the thyroid hormone. The thyroid hormones play a major role in the metabolism, growth and development of the human body. The most common functions are: 1. Control energy expenditure of the body. 2. Stimulate heart contraction and heart rate. 3. Stimulate carbohydrate, protein and fat metabolism. 4. Increase in the synthesis and degradation of cholesterol and triglycerides. 5. Stimulate growth and maturity of skeletal bones. 6. It increases the sensitivity of the beta-adrenergic receptor to catecholamine. Thyroid disorders. Impaired function of thyroid gland will cause body metabolism to be faster or slower from what the body actually needs. These abnormal conditions are categorized as hyperthyroidism or hypothyroidism. Hyperthyroidism is an overactive thyroid, occurs when the thyroid gland produces too much of the hormone that body, while hypothyroidism is an underactive thyroid, occurs when the thyroid gland does not produce enough hormones. The other common thyroid disorders are thyroiditis, inflammation of thyroid gland. Goiter is an unusual enlargement of thyroid gland. And thyroid cancer, a disease in which malignant cells form in the tissues of the thyroid gland. Diagnosis of thyroid disorders. The doctors can diagnose thyroid problem by testing the levels of thyroid hormones in the blood, which called thyroid function test, TFT, to check how well the thyroid gland is working. The doctor will interpret the TFT results, together with your symptoms and how you feel, in order to diagnose whether you have a thyroid disorder, how severe it is, and monitor the response of thyroid disorders to treatment. Thyroid function test, TFT. TFT measuring the amount of the thyroid hormones, free T3 and free T4 and the pituitary hormone, TSH in the blood, which are used to diagnose decreased and increased thyroid function, hypothyroidism and hyperthyroidism respectively. The table show the combination of TSH, FT4 and FT3 results with its interpretation. If the TSH is high with normal FT3 and FT4, this result may indicate mild or subclinical hypothyroidism. The TSH is high and FT4 is low in underactive thyroid, hypothyroidism, while the FT3 can be low or normal. This makes FT3 rarely helpful in diagnosing hypothyroidism. When the TSH is low with normal FT4 and FT3, the result suggests mild or subclinical hyperthyroidism. In overactive thyroid, hyperthyroidism, the TSH is low, and both FT4 and FT3 are high. In rare cases, FT4 and FT3 can be normal as well in hyperthyroidism. Low TSH with low FT4 and FT3 may be a result of the secondary hypothyroidism, pituitary gland failure, or a response to a significant non-thyroidal illness. Normal TSH with high FT4 and FT3 may suggest thyroid hormone resistance syndrome. A mutation in the thyroid hormone receptor decreases thyroid hormone function. When you have an enlarged thyroid, goiter, and/or when your TFT result indicate thyroid dysfunction, one or more thyroid antibody tests can be ordered to rule out the suspicion of an autoimmune thyroid disease. The main thyroid antibodies are thyroid peroxidase antibodies, DPOAB, thyroglobulin antibodies, DGAB, and thyroid-stimulating hormone receptor antibodies, TSHRAB, also known as TRAB. The presence of thyroid antibodies and the higher the level in the blood, the more likely suggestive of autoimmune thyroid disease. Thank you for watching this video.